Hello everybody. For this video, I would like to go over another very common mental health disorder that many people go through more than we may think. It may be lasting through a lifetime, it may be episodic, and at times it can be related to triggers or situations. The one I'm going to discuss is depression. Now, depression affects many people, and it affects a majority of the population at least at some point in someone's life. It is a little bit overlapped with anxiety in a sense where if you were to take a Venn diagram and one bubble is anxiety and the other one is depression, there's a bit of an overlap with symptoms such as irritability, lack of motivation, and such. But with this sense, depression would be a little bit more of a thing that causes you or the individual experiencing it to feel all of a sudden like they're kind of stuck in their tracks or unmotivated, and just an immense level of sadness and even numbness can overflow onto the person, and it can affect the way they have an outlook towards life. In technical terms, depression falls under an affective disorder. Affective derives from the term how it affects the person's feelings and emotions, and disorder, it gives you those disordered feelings. So referring back to my notes, there are different types of depression. They're major affective disorders, and the different types that can fall under that category would be bipolar disorder, and then there's unipolar depression. So whereas bipolar disorder, which I will discuss in a further video, has to do with cyclic fluctuations, if you were to say, of manic episodes and depressive episodes. Unipolar depression simply is depressive episodes, flatline in general, and that is a little bit more of the depression that we're familiar with. I'll highlight that in a later video when I do discuss bipolar disorder. But there are different treatment options, and there are different coping mechanisms that I will also like to discuss for depression. Now, when it comes to the psychobiological perspective of depression, what happens is that the brain produces neurotransmitters, and those neurotransmitters all have different functions and all travel through the brain with different purposes. Now, when it comes to hi Bodhi, that's my cat. When it comes to serotonin, serotonin is a molecule that makes you feel happy. And come here. Okay, hang on. I'm gonna have to pause this and continue. And we're back. Okay, I'm so sorry for that. As I was saying, whenever it comes to the different neurotransmitters, serotonin is responsible for, in layman's terms and in the simplest definition, serotonin is linked to happiness, and because of that, it creates this feeling of happiness, it balances out your emotions, and it causes that joyous feeling to overcome your brain. But with people who are depressed, there's a little bit more of an inactivity or very low frequency level of serotonin traveling through the neural pathways in the brain. And that can be caused by many different things. It can be caused by a life situation, perhaps it's a mentality. The brain wiring is a little bit different, and I would like to highlight that you can rewire your brain with simple practices that you carry on every day. The way your everyday lifestyle starts changing, you have the ability to rewire your brain. But sometimes, for example, if an individual is stuck in a lot of situations that cause them to feel depressed, the wiring in their brain gets fixated on that and makes that a routine. So what happens is that it stops producing that over excessive amount of serotonin, or not even an excessive amount of serotonin. It stops producing the amount of serotonin that'll outweigh any other emotion that you're having. And therefore, the serotonin isn't strong enough to lift you up out of that. But what happens is that somebody can get stuck there, and it does feel like that when a person is depressed. So what happens when someone is depressed is they will feel mentally down, they'll feel even physically down. There are studies that say that the neural imaging and emotions and parts that light up in the brain, basically, if you were to compare a depressed person's brain, or someone specifically with major depressive disorder, and if you were to compare that to the brain scanning of someone who's paraplegic, which means that they're physically disabled, the brain scannings are very similar. The level of happiness in that life, and for example, lack of motivation, even, all of that depression is linked as if that person is actually physically hurt or physically incapable. And there's a study also that says that a person who does go through a major life change such as paraplegia can actually bounce back from that, whereas depression is similar to the way that person feels at that lowest point without bouncing back, unless they seek treatment options or something changes in their lifestyle that can help rewire their psyche. Now, when I discuss this, I would also like to go over that specific realm of major depressive disorder, because that is when it's at its worst. It's when it's at its most severity. Now, referencing back to my notes, I do not want to leave anything out, but this can actually affect your sleep cycle. And I went over the fact that sleep can be affected in an earlier video, that it can have a big effect in how you perceive life and how you carry on in your day-to-day life. So when someone is depressed, they have increased sleep latency, they have frequent awakenings, they have very shallow sleep stages, so they're constantly in a light sleep stage, and their REM sleep is a little bit longer, so they'll have dreams, and then those dreams can act upon those depressive moods. So what ends up happening is that it's kind of a vicious cycle. If depression affects your sleep, and then your sleep is depriving all of that necessary recuperation that your brain needs in order to uplift you a little bit more. So it's very important to try to, if you're already trying to assess and address all the symptoms that you have that are related to depression, it's important for the main one to be focused upon is your sleep quality. It's important to take the necessary measures in order to get enough sleep, so at least your brain is strong enough to withstand the energy, do all of the neural pathways that it needs to, let out the neurotransmitters it needs to, and function properly in your day-to-day life, because then it gets stuck in that little Ouroboros, or the snake is eating the tail, with that depressive feeling. And it's pretty important to realize that. I mean, it can cause people to be insomniac, and it can even cause people to be hypersomniac. So it's just a matter of finding a little bit of that balance, because since this disorder will cause somebody to not only feel mentally or emotionally down, it'll cause them to feel physically down. That's just an example of how it can go to that route. And some people who are depressed typically may feel well functioning in society, but there's an underlying feeling of a lack inside, or just an inability to feel happy, or an inability to motivate oneself, or an inability to get out of this place where they feel stuck. And a lot of it there's a lot of different factors that it can actually link to that. It could be a low self-esteem, it can be a major life situation, it can also be the self-perception that someone has. And there are different treatment options, because of the fact that it's such a broad topic. I'm pretty sure if you already clicked this video, you are familiar with how depression feels. It feels like not being able to live your life the way you normally want to. A little bit like there's a veil in front of you that keeps you separated from that world and yourself. And it makes the person on the other side of that veil feel like they cannot completely engage in that. It has so many different variations. It shows up as irritability even. It shows up as being low motivated. It shows up as someone high functioning, but just feeling a weird emptiness inside of them. So there are a very broad spectrum to depression, but if you do seek help, there's counseling, and the best one could be cognitive behavioral therapy, as is the same one for anxiety disorders. And just simple psychotherapy can help. Talking to a counselor can help, because typically it's an emotion that's a little bit more Whereas it's a little different than anxiety. It's not necessarily projected towards the future. It's a little bit more of like in a lot of different books I've read, they say that depression is a little bit more linked into ruminating over the same feeling or same thought patterns or situation over and over again, and it causes that person to just feel down. So it can just be perhaps going to a therapy session where you can like get rid of that burden and get rid of that baggage from perhaps a past situation or past trauma or just something that you're ruminating in. It can help to just let it out, and maybe that can help you understand what you're feeling a little bit more, or at least where the source may be, because sometimes it's a little bit hard to pinpoint the source until you actually talk about it and you start digging in a little bit deeper. But it's best to get through it with help and with the company of other people, or even a companion of a pet. And but therapy and counseling is certainly a very effective way to do it. Just to simply talk to somebody and have someone understand you can be a big enough change for someone who's experiencing depression. When it comes to, however, prescriptions and depression treatment options, there's a monoamine oxidase inhibitors. So they inhibit certain neurotransmitters that may be a little overactive because of the depressive moods. They reuptake a lot of norepinephrine, and they help enable channels to open up in order to let that serotonin, that little happiness molecule, to flow through your brain a little bit more frequently and in bigger numbers. And there's also tricycle antidepressants, but that is something, again, all of these medicinal resources that I'm giving you, you definitely need to talk to with your counselor or psychiatrist or psychologist or doctor, because everyone does react differently. People have been said and reported that antidepressants actually make an individual feel more depressed. So it's definitely something to consider. While medicine can help, like for example, SSRIs, which are selective serotonin reuptake inhibitors, and that includes Prozac and such. Whereas that can help, it is important for you to also not only just rely on, for example, that magic pill to make you feel better, but it's important for you to also do that inner work and digging deep and trying to do the little things in your everyday life to actually better yourself, so that way you're not relying on that magic pill to be your crutch. You're becoming a little bit more self-sufficient and taking control of your mental health, and that is an aid for you. You should treat the medicine as an aid to get you through it, whereas the counseling, the inner work, addressing trauma, and doing daily practices that get you out of the depression slump are a little bit more effective in the long run, in my opinion, and they're easily accessible, and it's something that you can constantly work on and grow through. Now, there are different forms too. I'm pretty sure that many of you are familiar with this, but since it is an affective disorder, think about where else that word stems from. There's this thing called seasonal affective disorder, and that happens when, for example, during a specific season, it may affect a person a little bit more. So the episode won't necessarily be just out of the blue. For example, the episode can, and it usually does trigger a lot of people during winter for some reason, and reason being, and treatment options for it, as a matter of fact, is because of the fact that the days are shorter. So seasonal affective disorder has a little bit more to do with the season, and it has a little bit more to do with light, because it has been known through many studies that phototherapy is actually very effective for people who are depressed, and especially for seasonal affective disorder. For example, you need a little bit more sunshine, and sunshine is actually something within reason with sunscreen and safely put. We don't need you to get any sort of skin disorder out of this, but it's important to get a good daily dose of sunlight, because it actually does help enable that serotonin production, and it can help a person get out of a depressive state over time. It's one of those daily practices that I said, like, while medicine can be helpful, I think that's a little daily practice that can actually get you out of it, and in a consistent way where there are no side effects. It only has benefits. So to get out of a depression slump, phototherapy is also very effective. That's a thing that you can do every day, that you don't have to worry about going to a place to access or a pharmacy to access. Doing that Giving yourself a routine too. For example, someone who's depressed may feel like they don't want to get out of bed. They just don't want to get out of bed. Their body hurts to get out of bed, and they just don't feel the motivation to get out. So maybe perhaps little things like putting your alarm clock across the room where you have no choice. I need to turn off my alarm clock. I'm going to have to get up and do that. And then going into those incremental tasks. They don't have to be huge tasks, but try to give yourself a little checklist of things that are very attainable and don't give you stress in order to create that bigger goal of getting yourself into having a good and productive day. For example, okay, if the person who is depressed is not wanting to get out of bed, all right, the alarm clock is across the room. Okay, no matter how the mood is right now, it's a fact that that alarm needs to be set off. You get up, set off the alarm, boom, dismiss it. Okay, I'm already up. Am I gonna lay back in bed and think, okay, let me just go use the restroom and freshen up a little bit? I can do that. I can brush my teeth, I can wash my face a little bit. I can splash some cold water to just kind of like perk me up a little bit. I can go ahead, okay, and then once you do those little tasks, you're like, okay, I did 2 tasks already, little tasks. Then tell yourself, okay, make the bed. That's always been a big motivator, and I've heard it throughout my life for people who have experienced depression, people who have gone through loss, people that have been grieving, that for some reason it's just a saying that gets traveled around, and it's a simple saying, yet it has so much weight and so much effectiveness. Just tell yourself to make the bed. Just make the bed. Make the bed, boom. Okay, I need to eat something. Let me see, maybe I can find something that makes me a little excited. Let me try something that's a little exciting, or even tell yourself, you know what, depression, I know you're there, but I need to eat. I need to sustain my vessel. I need to sustain my physical health and my body, so I'm going to eat something. And you see where I'm going. I'm pretty sure you know where I'm going with this. It's those incremental little goals that can actually make such a difference in your everyday life. That helps a lot too. Just setting yourself a little bit of a routine to look forward to, a little bit of a routine to give yourself time to warm into your day with kindness and with compassion. Remember to treat yourself with kindness and compassion. And a lot of other things that can help too is reaching out to others. Sometimes it's actually very common for a depressed person to want to withdraw from all social engagements, to withdraw from being around family and friends. But it is important to not react upon those emotions, or not react on the temporariness of the emotions, and just think in the long run, if these are people you truly care about and you do want in your life, then don't let that depression take them away from you, if that makes sense. Kind of bring yourself outside of your head instead of thinking, oh, my depression is this, or I'm this because I'm this. No, just be like, you know what? Separate yourself from the depression. You're a separate entity from depression. And say, I'm not going to let the depression keep me away from who I love. I'm not going to let the depression keep me from building a memory with this person or having a conversation. And while it may be a little tough at first, it's those little changes in your life that you'll thank yourself for in the long run, because you were able to get yourself out of it. And like I said, it's not necessarily a one-size-fits-all kind of route to take when it comes to depression, because it is a more broad topic, but it's something that can be addressed and can be overcome. And it's something that I believe there are many resources out there to aid you in getting rid of it, but along that there are different things that you can do in your daily life that can get you to be in the mood you want to be in. It can get you to get out of that. It can get you back to your life. It can get you back to living your life. And while there are different severities of it, there's mild depression, moderate depression, and severe depression, it is very important to reach out to your loved ones. It is important to reach out to those support systems and seek them if they're not readily available, because you got to do it for yourself. You got to fight for your life. You have so much life ahead of you, and life will have its trials and tribulations. It definitely will. I mean, it's a fact. It's like a little checkerboard. There's the white and black pieces, but together they make the whole game. And it's important to just keep fighting, because don't you want to see those days that you feel good, those days that you can build your memories? And the only way you can really think of seeing yourself there is by taking those little steps of self-care and self-love for your mental health, your emotional health, and your well-being to get yourself there. And I know you can do it. And if you're watching this, forward it to somebody who you feel has been a little depressed, or take it into account for yourself and revisit it as many times as you need to. And I really hope that every time you revisit it, or at least every time you ask yourself how you're feeling, that you're getting better and better, because you are worth it. You are worth the fight. You are worth showing up for your own life, and you are worth taking all the things that life can give and creating something beautiful out of it. Don't let depression keep you away from your life. Don't let it take your life away from you. You deserve more than that. Think about it this way. If you had a loved one that was depressed, how would you talk to them? Now, if you're the one depressed, talk to yourself the way you would talk to your loved one going through it. Be kind to yourself and take care of your mental health, and I hope you have a good mental health day. Thank you for watching.